Many hospitals have secured used needle boxes along the hallways. It's a good idea to look at these as you patrol. While nursing homes will have you typically patrol the hallways and the general areas, many nursing homes will not allow you to enter a patient's or resident's room, unless it's for an emergency. Do not enter a patient's room unless you are authorized. Vendors are in and out of a hospital and nursing home all day long. They're delivering supplies, food, and other goods that are needed. But don't just wave them by because they have a delivery uniform on. Always verify and check to make sure that they're supposed to be on the property. While most cleaning staff are trustworthy, sometimes there is a bad apple. Be mindful and on the lookout for the following. While it may not happen often, there's always a chance that someone from the outside tries to injure or kill a patient that was a witness to a crime or a party to an illegal act. Hospitals use chemicals. Many treatments include certain dangerous chemicals. This is another reason those treatment areas are restricted, to help prevent chemicals from escaping an area. Mercury spills from damaged medical devices and thermometers can also occur. The metallic liquid, if exposed to humans, can be a serious health risk. In the case of an active fire or fire emergency, you must without delay notify the fire department and help evacuate the premises immediately. Intensive care units, or sometimes called ICU, are highly restricted areas. These areas treat patients who are in life-threatening conditions which require direct nurse care 24 hours a day. Many nursing homes experience patients with Alzheimer's or dementia. Their confusion can cause them to act out in anger or crying. You need to be mindful of this and be extra gentle in your communication with them. You should always call for a nurse to assist. Any patient needs should be addressed directly by a nurse. Remember that emotions run high at a medical facility. So if there's a visitor who will not leave, you need to politely remind them that visiting hours are over and that they must now exit. Facial expressions can be voluntary, like smiling for the camera, or involuntary, like getting caught in a barefaced lie. Whenever you see someone giving negative expression or negative body language, consider them to be clues regarding their current disposition and truthfulness. Security officers must understand the importance of confidentiality and know their role in helping to maintain all HIPAA standards. Normally, you'll not have any knowledge of a patient's private medical information. However, if you accidentally hear or receive knowledge of a patient's medical information, you're not allowed to relay this to anyone,